at a very relevant time in our country, as already indicated by Dr. Jacobs, our chair of the Portfolio Committee. After almost over 3 years of hard work with breaks as a result of the COVID pandemic, our parliamentary committee in the National Assembly has been working very hard in processing the bill, the NHI bill, which was tabled in Parliament by my predecessors, both Minister Mtswaledi and also Minister Mkhize. And where we are now, significant progress has been made, as he had indicated. They're just about when Parliament adjourned, and because tomorrow we're just going for one particular item, the rest of the business has been concluded for the year. They had virtually completed the main work on the bill, and in the coming year, they will be able to finalize it and table it to the full sitting of the National Assembly. So we can say we're at a critical time when the legal framework for our approach to universal health coverage is almost getting completed. Of course, in our system from the National Assembly, it still has to go to the National Council of Provinces. Now, the aspiration to create universal health coverage, as Dr. Lomo touched on some of the history, I'll just add to that this is indeed not a new aspiration, but it's taking us just too long. That Clarkman and also his commission, but also when you look from the striving for UHC has also been part and parcel of our liberation struggle, from the African claims of the 1940s to the Freedom Charter. And this then finds embodiment in our Constitution, as already referred to earlier, at Section 27 in our Bill of Rights, which states that the state must take progressive steps for the realization of the right to health within the limit of its resources. Now, all nations of the world, under the leadership of the World Health Organization and also the United Nations, have acknowledged health as a human right, which must be accessed by all citizens. And it is for this reason that, as Deputy Minister referred to earlier on, that there was this high-level United Nations General Assembly where heads of states actually, came together to address the need for universal health coverage and adopted a declaration on the 23rd of September. And I'll just highlight some of the key messages in terms of what the heads of state actually identified and agreed upon as measures which needed to be taken. Just to give some highlights, the heads of state reaffirmed the right of every human being without distinction of any kind to the enjoyment of the highest attainable standard of physical and mental health. That's what the heads of states committed to. They also committed to reaffirming the need for, stressing the need for a comprehensive and people-centered approach with a view of leaving no one behind. Just to highlight other resolutions within the resolution, they also affirmed the need for strong political commitment to address the challenge of financing, as Dr. Kutsen was indicating, very difficult one, but the heads of state reaffirmed this commitment to address the challenge of financing and creating an enabling environment in this regard. Also recognizing that universal health coverage is fundamental to the achievement of the SDG. Also recognizing that health is an investment in the human capital and social and economic development towards the full realization of the human potential. They also recognize that universal health coverage implies that all people should have access without discrimination to nationally determined sets of needed, that without discrimination to nationally determined sets of the needed promotive, preventive, curative, and rehabilitative and palliative essential services. These are some of the commitments which our heads of states made. They also recognize the need for health systems that are strong, resilient, functional, well-governed, responsive, and accountable. So this comes from no other than our heads of states. And they also recognized the need, they also recognize that at the current 2019, that at the up to 1/3 of the world's population will remain underserved by 2030. And a measurable acceleration is urgently needed to reach the health-related targets of the SDGs. So these were in the declaration of the heads of states. And they also reaffirmed the importance of the primary health care, that governments must take responsibility to make sure that this is achieved. Now, in terms of what did they then commit to do, I'll just touch on a few areas of the commitments after having accepted the current state and what needed to be done. They make the commitment to accelerate efforts towards the achievement of universal health coverage by 2030. Now, this is 2020, so we're talking about 8 years from now. And this is what our heads of states have actually committed to, that we must accelerate the effort achievement of UHC by 2030. We must implement the most effective, high-impact, quality-assured, people-centered, gender and disability responsive and evidence-based interventions to meet the health needs of all throughout the life course, and in particular, those who are more vulnerable. That was what the heads of states committed to. And lastly, just in terms of the commitments, just to take a few, they've also committed to prioritize health promotion and disease prevention through public health policies, good governance of health systems, education, health communication, and health literacy, as well as safe, healthy, and resilient cities, enabling people throughout their life course, including, amongst others, adolescents, to have increased knowledge to take informed health decisions and improve health-seeking behavior. So these were the declarations which were made just in 2019, which is just 3 years ago, by our heads of state at the high-level meeting at the United Nations. Now, unfortunately, as it's now common knowledge, hardly 5 months after this declaration, COVID descended on us and disrupted all our health services worldwide and in our own country. But the very same pandemic exposed the weaknesses of our health systems. Now, listening to Dr. Joe Phaahla there, you don't need the rocket science to also understand the unfortunate consequences that the US, in terms of per capita expenditure, it's the most highest in the world, the most inefficient, and maybe, you know, as hard as it is, it could explain why, when we look at the mortality rate from COVID, the US tops. I'm not sure the current, I think the last time I looked at that worldometer, the US was almost at 1 million of people who have succumbed to COVID-19. All of us can remember, you know, I mean, a big city like New York, the capital, the financial and economic capital of the world, the kind of calamity which befell that city. And but what it says is all that money was being wrongly utilized. And that's why you have the kind of consequences. So, you know, and then you look at the poor country, Deputy Minister was talking about the health systems of Cuba, the preventative, community-based. Cuba had one of the lowest in terms of mortality rate as one of the poorest countries. But also the paradox, the country which is implementing a blockade on the poor country had the highest calamity of COVID, when the country on which they are imposing a blockade had the lowest, among the lowest mortalities, simply because in terms of the approach and the use of the resources, which is lopsided. In our country as well, the struggle to realize a good quality, equitable health system has experienced a lot of ups and downs, in as much as we know what has happened in many parts of the world. Some positives: since the advent of our democracy, as early as 1995, President Mandela declared that there should be free health services for pregnant women and also for children under 6, very early in our democracy. We subsequently also scrapped all user fees for primary health care level. While we have retained some fees at hospital levels, we have made sure that this fee system is quite manageable and affordable, and that it does not become an ultimate barrier in terms of access by South Africans to basic health services, especially in terms of emergency services. But there's also been, and there's a lot which, you know, in terms of access, which has been done to make sure that South Africans have access. The challenge which we face is the inequality because of the desperation in terms of funding, and which therefore complicates in terms of the quality of the services. On the negative side, quite a few which Dr. Kutsen has also alluded to. Practically from our side, in other direction, we went completely the wrong direction, which is why he's warning that if we don't stop it, we will be completely Americanized. We allowed a proliferation of privatization of health services, especially hospital services, and also especially specialist services. Acceleration of commodification of health services with the twin growth of private health insurance, which is alluded to here as one of the anomalies of South Africa, with a lot of products in the private insurance, big, you know, stock, many of them administrators. I mean, we have this notion that medical aid schemes are non-profit organizations, but the administrators are not. I'm sure CMS can say a little bit more. Dr. Kabane, I'm sure you can tell us a bit more about what we need to do, because some of these are on the JSE, you know, these health insurance products. And a proliferation of various forms of fee-for-service in the private sector, where, you know, the issue of regulating this, we've basically dropped the ball in this area. Poor regulation of the private health sector, leading to huge profits for private hospitals. Private hospital companies currently are more lucrative to their shareholders, performing on the JSC much better than productive economic companies in the productive economy. It is common knowledge today that your top 3 private hospital companies are much more profitable than mining companies, much more profitable than food producers. Agriculture, farming, can't compete with your top companies which are on the stock exchange, much more profitable than manufacturing companies. So that's the direction, the wrong direction in which we have gone. Fee for service coupled with the collapse of regulated referral. A few years ago, some years ago, you could not just wake up and go and see a specialist physician or a specialist surgeon or pediatrician. You had to go through your clinic, your GP. But today we've left all that. Anybody you can wake up in the morning and make a booking with your physician, and your medical aid will not query that. When the bill comes of 5,000, 10,000, they pay. And in a 5 months' time, they tell you your funds are exhausted. But that's the system. And of course, I believe that that is the reason why the market inquiry led by former Justice Ngobo found us wanting as government in terms of the instruments at our disposal, which is regulation, which we have not put to good use. Now, even our public service institutions have not been unaffected by this. We have been forced to adapt our systems by allowance of remuneration work outside the public service, RWAPs, to retain the specialists because otherwise they leave, leading to many of our current medical schools suffering, medical students suffering from poor attention by their lecturers, their professors, and their specialist teachers. Many of our undergraduate students suffer lack of attention by their teachers because they spent, because of the allowance of these RWAPs, and even postgrads. And that's why, when we were saying because of challenges of funding, whether we should review the 2-year internship, the response overall was, it's not possible. I mean, we shouldn't even go there because the quality of teaching and supervision of undergraduate has dropped a lot. So you need the 2-year internship so that, those graduates can be able to catch up. Now, in recognition of this situation, President Ramaphosa, in his first year in office, convened the Presidential Health Summit, which, if I'm not mistaken, was held in this very same hotel in October 2018. And a few later on in 2019, arising out of that Presidential Health Summit, we had the signing of the Presidential Compact on Health, which brought together a number of role players, 9 pillars to improve to strengthen our health systems were identified from, across, I'm sure many of us here are familiar in terms of improving our human resources, improving in terms of our infrastructure, making sure that, our supply chain systems, commodities like pharmaceutical supplies can be stabilized. So we have identified the areas in which we need to intervene. The question now is how do we move forward from here to make sure that those can actually be implemented. So this dialogue today, this morning, takes place within this context. So we are conscious of the fact that, as already indicated by previous speakers and alluded to also by the last speaker, Dr. Joe Phaahla, that legislation, putting the legislative framework as important as it is in terms of providing one of the areas, and Dr. Kalua also alluded to this, that financing in itself is not the only solution. It's key, but it's not the only solution. But the legislation which is in Parliament, which will provide a framework for unified funding, which will provide a single payer and single purchaser system is very fundamental. But also that it is important that we, as we are gathered here, we recognize that we need to do away with also the elephant in the room, which is our highly fragmented health system, the two-tier health system, which exacerbates inequality and increases inefficiency, and assures that the available financial resources are scattered all over and largely spent. The big chunk of our 8.9% of GDP, which is spent on health services, still a little bit better than US at 19%, but as he has warned, we're also getting there, but the outcomes very poor. Also in terms of, we know that comparing to equal kind of economic size countries, our 8.9% is still, very high in terms of compared with the outcomes which many countries which spend much less than us are able to achieve. So as we tackle this fragmentation, we must look at various interventions through which we can be able to improve the quality and the capacity of our public health system, which is the bedrock of the provision of health services in our country and will remain the bedrock of the achievement of universal health coverage. Primary health care within the public health service is also the foundation for the achievement of universal health coverage, as already spelled out by the world leaders at the UN high-level political declaration. So my appeal to the dialogue here in the remainder of the day is that while it is important that we are laying the foundation of universal health coverage through the national health insurance, we should not wait for that completion. That process is still going to take, as I said, in the coming year, we're expecting that the National Assembly will finalize it. From there, it will go to the National Council of Provinces, where it will be finalized before it can become an act of parliament, which must then be signed by the president. But we know also that there's going to be a lot of challenges already. There's already challenges. Just in terms of the implementation of our own structure of preparing for the national health insurance in the department, we're already in court with some of the right-wing organizations which are challenging just laying the basis for the implementation of the NHI. Now, as Dr. Joe Phaahla has indicated, we're dealing here with, very strong financial companies. Huge incomes, very deep financial interests, deep pockets. Already we saw with just the market inquiry, the private health, and many of those companies already booked. All your top lawyers in the country were unavailable to the government to represent the views of government in the inquiry. I can assure you, once this bill is passed in the National Assembly, already there will be a slew of litigations. So my appeal is that as we discuss in terms of these reforms which we need to engage in order to save our country and make sure that we can be able to reverse the wrong direction in which we are going. We must be able to look at within even the regulatory environment and the legislative environment existing in the country now, which are the areas in which we can be able to start to improve, to make sure that we can strengthen the public health service, and we can be able to reduce also already as Dr. Joe Phaahla was showing there, that government is not innocent in this wrong direction. 30% of this private individual medical cover is actually funded by government itself. 30% of it is funded by government itself. We even have our own medical schemes like GEMS, like my own medical scheme, parliamentary medical scheme called PAMET, which is broke. So now the question is, within this current situation, rather than simply, all that I'm cautioning colleagues is, Parliament and the parliamentarians are doing their bit in terms of giving us a framework with the support of various stakeholders, as Dr. Jacobs indicated there, that there is a lot of support for the national health insurance. But I'm pleading with us as we gathered here and as we exchange our views, can we look at things which can be done tomorrow in terms of, even in the existing environment? And I'm hoping that looking at some of the speakers who are coming in the human resources, in just in the various areas of, improving our health systems and reducing, the dominance of, the private health, system which is depleting the resources of the country. What are the areas in which, in fact, even within the existing situation, we can be able to reverse the direction and make sure we lay the foundation? So I'm looking forward to a number of, creative ideas arising out of this dialogue, so that even as we close this year, and this is very strategic that we have in this dialogue at the end of the year, so that new ideas can come in as we start the 2023 year, we can be able to look at various interventions which we can already implement to make sure that we can reverse that threat of Americanization of our health system. So I look forward, colleagues, to the discussions here. Unfortunately, I'll listen to a few, but I'm going to miss some as I have other engagements later in the day before leaving for Cape Town. But all the best, and indeed, we hope there will be very creative ideas coming out of this dialogue. Thank you very much.